Ankle syndesmosis injuries. People with an external foot-out rotation mechanism who have generalised swelling and pain a little higher up on the ankle may have a syndesmosis or high ankle injury, which might be unstable and should be referred for a further workup. Most of the time, it's very hard to remember which way the foot actually went during an ankle sprain. So, when there is pain higher than expected, we need to be on alert for this potential injury. You can see in this animation that the ankle joint normally functions like a hinge, with the two lower bones of the leg, the tibia and the fibula, locking into the saddle-shaped bone in the middle called the talus. When a forceful sideways motion occurs, where the foot goes out to the side, this opens up the hinge and spreads the strong ligaments between the two bones. Now, we know that the classic mechanism always occurs in a front to back pattern, like a book opening up, and therefore tenderness around the front part of the ankle is actually quite suggestive of injury because it's the first ligament part of the ligament complex to tear. The diagnosis of an ankle syndesmosis injury can be made quite confidently through a combination of clinical tests, but an ultrasound at the point of care adds the advantage of being able to see the ligament at the front for any damage, as we know that the front of the ligament complex tears first. MRI can then also determine whether there are any other associated injuries and confirm whether there is syndesmotic injury. Treatment. As with any acute injury, the principles are to control the initial inflammatory response with rest, optimal loading, ice compression and elevation. The severity of ligament damage or associated cartilage or bony injury determine whether surgery is needed. Most cases are lower grade injuries that can be certainly managed non-operatively with the use of a stirrup that helps push the ends of the bone together to accommodate the ligament healing in a tighter, more functional position. In my previous research, we found that rugby players with these injuries were able to return to play an average of 3 weeks sooner with a single platelet-rich plasma injection to the torn ligament at the front, when combined with standard rehabilitation. The following serves as a basic guide to the rehabilitation milestones for stable syndesmosis injuries. Generally, recovery takes 6 to 10 weeks and a single PRP injection can help. After injury, a boot or ankle stirrup with crutches should be used until the patient has minimal tenderness over the front of the ankle at the AITFL and can double leg lunge pain-free. Then the ankle stirrup and walking can be used until they're pain-free with a single leg lunge. Then an ankle stirrup and cross training until they have pain-free single leg hopping. And the ankle stirrup with straight line running can then be commenced. Once they've been able to do this for a week, sport-specific retraining can be performed to get them back to the specific requirements of their sport.
I hope you found this video useful. I create these educational videos to help empower patients by allowing them to understand their problem, treatment options, and the expected recovery. Please remember, this lecture is for educational purposes only, does not constitute the giving of medical advice, and no patient-doctor relationship is formed.